5 early signs of kidney damage you must not ignore. Did you know that over 1 in 7 American adults have chronic kidney disease, CKD, but most don't even know it? In fact, 9 out of 10 people with CKD are unaware of their condition. Kidney disease can progress silently for 10-20 years, often without symptoms, until it reaches end-stage kidney disease, ESKD, where kidney function drops to just 10–15%. The best way to tackle CKD is by catching it early. Unfortunately, CKD rarely shows symptoms in its early stages. However, abnormal lab test results can help diagnose it early. We'll talk about these tests soon, but first, let's explore some early signs and symptoms you might notice at home. Before we dive in, remember, this information is created by experts, fact-checked, unbiased, and reviewed by professionals. Stay tuned to learn how you can protect your kidneys and spot potential issues early. Foamy urine. Foamy urine refers to persistent layers of small to medium-sized bubbles in the toilet bowl. A single layer of large bubbles that quickly disappear is normal and often caused by the force of urine flow or natural substances in the urine. However, foamy urine in chronic kidney disease, CKD, is usually due to proteinuria, which means proteins, such as albumin, are present in the urine. Albumin is a protein that should remain in the bloodstream, but damaged kidneys can allow it to leak into the urine. This condition, called albuminuria, is one of the earliest signs of kidney disease and may appear as early as stage 1 CKD. It's important to note that not everyone with foamy urine has CKD. In fact, only about 1/3 of people reporting foamy urine are found to have abnormal protein levels. If you notice persistent foamy urine, consult a healthcare provider to rule out any underlying issues and get the right diagnosis. 4. Nocturia. Nocturia, the need to wake up at night to urinate, is often linked to polyuria, which is excessive urine production. This can occur with chronic kidney disease, CKD, and may happen only at night, nocturnal polyuria, or throughout the day. CKD disrupts the balance of salt and water in the body, leading to this symptom. Age-related changes in circadian rhythms, your body's sleep-wake cycle, can also contribute to nocturia. Other common causes include diabetes, prostate enlargement, pregnancy, urinary tract infections, and more. Nocturia can be an early sign of CKD. Studies have found that declining kidney function, measured by the estimated glomerular filtration rate, eGFR, a marker of how well your kidneys filter waste, correlates with more frequent nocturia episodes. A 2023 study showed that individuals with nocturia had slightly reduced eGFR compared to those without it. If you're waking up often at night to urinate, it might be worth checking with a healthcare professional to assess your kidney health and rule out other causes. Are you finding this content helpful? If yes, please let us know by dropping a like or sharing your thoughts. Your support helps us create more valuable content just for you. Blood in the urine hematuria refers to the presence of blood in the urine, which can appear as gross hematuria, visible blood, or microscopic hematuria, not visible to the naked eye. Both types may be early signs of chronic kidney disease, CKD. If your urine appears bloody, red, pink, brown, or tea-colored, it might indicate gross hematuria caused by bleeding in the urinary tract. On the other hand, microscopic hematuria is invisible to the naked eye and is typically detected during routine urinalysis. Urine dipstick tests and microscopic analysis are the most common methods to confirm hematuria. A 2018 study found that patients with moderate CKD and microscopic hematuria faced a higher risk of disease progression and mortality within the first 2 years. The study diagnosed hematuria using positive urine dipstick results and highlighted that the prevalence of hematuria increased as eGFR, a measure of kidney function, declined. If you notice any unusual changes in urine color, or if hematuria is detected during a test, it's essential to consult a healthcare provider. Early detection and management can help slow CKD progression and reduce associated risks. Decreased urination chronic kidney disease, CKD, can sometimes be linked to oliguria, or decreased urine production. However, CKD alone rarely causes low urine output. Instead, this typically occurs when acute kidney injury, AKI, develops on top of existing CKD. For instance, someone with chronic urinary obstruction causing CKD may experience urinary retention, leading to low or no urination. Other causes of oliguria include severe dehydration, shock, or reduced blood flow to the kidneys due to various conditions. These factors can trigger an acute decline in kidney function, worsening the underlying CKD. Oliguria is a warning sign of serious kidney problems and requires immediate medical attention. Early intervention can help address the underlying cause, prevent further kidney damage, and improve outcomes. If you or someone you know notices significantly reduced urine output, especially alongside other symptoms like swelling, fatigue, or changes in urine color, it's essential to consult a healthcare provider promptly. Understanding and managing the interplay between CKD and potential triggers like dehydration or obstruction can make a big difference in kidney health. Stay informed and proactive to protect your kidneys. Flank pain refers to discomfort on the side of the abdomen, between the ribs and hips. This pain is more common in people with chronic kidney disease, CKD, than in the general population, often due to direct kidney issues or related conditions. Chronic flank pain is a hallmark symptom of polycystic kidney disease, PKD, a genetic disorder. Other kidney-related causes of flank pain that may increase the risk of CKD include infections, inflammation, tumors, narrowing of the kidney's blood vessels, and vascular abnormalities. Additionally, conditions that block urine flow, such as kidney stones or congenital obstructions, can contribute to CKD and cause flank pain. If you experience persistent flank pain or other symptoms like changes in urine output or swelling, it's essential to act quickly. Early diagnosis and treatment can protect your kidneys and prevent CKD from worsening. Key steps include managing underlying conditions like diabetes or high blood pressure, staying hydrated, eating a kidney-friendly diet, and avoiding medications harmful to the kidneys. Regular checkups and lab tests can help detect issues early. Remember, taking proactive steps now can make a significant difference in preserving your kidney health and overall well-being. Risk factors: your risk of developing chronic kidney disease, CKD, increases if you have conditions like hypertension, diabetes, cardiovascular disease, or a history of acute kidney injury, AKI. Among these, hypertension and diabetes are the leading causes of CKD in U.S. adults. Research shows that 1 in 5 people with hypertension and 1 in 3 with diabetes will eventually develop CKD. Living in areas with a high CKD prevalence or exposure to harmful environmental factors can also increase your risk. Other risk factors include kidney stones, urinary tract abnormalities, HIV, lupus, vasculitis, long-term medication use, radiation therapy, or a family history of kidney disease. The hallmark of CKD is reduced kidney function lasting at least 3 months, often progressing slowly over years. Doctors classify CKD into stages 1 to 5 based on your estimated glomerular filtration rate, eGFR, which measures how well your kidneys filter waste. CKD can lead to complications, including fluid and toxin buildup, high blood pressure, electrolyte imbalances, anemia, heart disease, and weak bones from low calcium and vitamin D levels. Symptoms typically appear in advanced stages and include fatigue, poor appetite, nausea, vomiting, weight loss, swelling in the eyes, legs and feet, shortness of breath, confusion, and a metallic taste in the mouth. If you have any of these risk factors or symptoms, it's essential to consult your doctor for testing and early intervention. Regular checkups, a healthy diet, and managing conditions like diabetes and hypertension can significantly reduce your risk and slow CKD progression. Early action is key to protecting your kidney health. Early diagnosis, How can you detect kidney disease? Early detecting chronic kidney disease, CKD early, is critical to slowing its progression and reducing complications. A recent study highlighted that individuals diagnosed with CKD at an earlier stage experienced slower kidney function decline compared to those diagnosed later. Early detection also helps delay complications and improve outcomes. CKD often progresses silently, showing no symptoms in its early stages. This is why regular screening is so important, especially for people with risk factors such as hypertension, diabetes, or heart disease. Timely diagnosis allows for better management and prevention of further kidney damage. Screening recommendations vary based on risk. For people with type 1 diabetes, screening should start 5 years after diagnosis. For those with type 2 diabetes, it should begin at diagnosis. Regular annual screening is also advised for anyone with a history of high blood pressure or other conditions linked to kidney disease. By identifying CKD early, healthcare providers can take steps to address underlying issues and implement measures to preserve kidney function. Don't wait for symptoms to appear. Proactive screening and awareness are key to protecting your kidney health and maintaining a better quality of life. 1. Blood test. Blood tests for detecting kidney disease. Blood tests are essential for assessing kidney health, with serum creatinine being one of the most reliable markers. Creatinine is a waste product formed during normal muscle metabolism. Measuring its levels helps calculate your estimated glomerular filtration rate, eGFR, a key indicator of kidney function. As kidney function declines, creatinine levels rise, signaling that your kidneys are not efficiently filtering waste. Another commonly used test is blood urea nitrogen, BUN, which measures the amount of urea, a waste product of protein metabolism, in your blood. While BUN provides useful information about kidney health, it is less reliable than serum creatinine because it can be influenced by various factors. For instance, malnutrition and starvation lower BUN levels, whereas dehydration, high protein intake, fever, burns, heart failure, and GI bleeding can increase BUN levels. Additionally, urinary outflow obstruction tends to raise BUN, making it less specific for kidney function. In contrast, serum creatinine levels remain unaffected by these conditions, making it a more consistent measure of kidney health. Regular blood tests, particularly those evaluating serum creatinine and eGFR, play a crucial role in detecting kidney issues early and guiding effective treatment strategies. 2. Urine tests for CKD screening. Urine tests are vital for detecting chronic kidney disease, CKD. One key test checks for proteins, particularly albumin, in the urine. Healthy kidneys keep albumin in the blood, but kidney damage can cause it to leak into the urine. The urinary albumin to creatinine ratio, UACR, is a common test that estimates the amount of protein loss in the urine. Elevated UACR levels indicate kidney damage and are an important marker for CKD. Other evidence of kidney damage includes blood in the urine, abnormal findings in a urine microscopic exam, CKD-related abnormalities on imaging or biopsy, electrolyte imbalances, or a history of a kidney transplant. Urine testing is a simple, non-invasive way to identify CKD early, even before symptoms appear. If abnormalities are detected, further evaluation can confirm the diagnosis and help guide treatment to protect kidney health. Treatment options for CKD. While chronic kidney disease, CKD, has no cure, treatments aim to slow progression, manage complications, and improve quality of life. Doctors may recommend medications, lifestyle changes, or other therapies. Key strategies include controlling blood pressure, managing diabetes, maintaining a kidney-friendly diet, and addressing complications like anemia or electrolyte imbalances to support overall kidney health. 1. Medication. Medication for CKD management. Medications play a critical role in managing chronic kidney disease, CKD, by controlling blood pressure, blood sugar, and lipid levels to slow disease progression and reduce complications. The KDIGO 2024 guidelines recommend keeping systolic blood pressure below 120 millibatitrus H/GR. For individuals with diabetes, the KDIGO 2022 guidelines suggest maintaining HbA1c, a measure of blood sugar, below 6.5% in Stage 1 CKD and below 8.0% in Stage 5 CKD. If these levels are outside the target range, your doctor may prescribe appropriate medications such as ACE inhibitors or ARBs for blood pressure and SGLT2 inhibitors for diabetes. However, CKD patients must be cautious about the medications they use. Certain drugs, such as non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and proton pump inhibitors, PPIs, like omeprazole or esomeprazole, can harm the kidneys. Always consult your doctor before taking any medication, even over-the-counter ones, to avoid worsening kidney function. Proper medication management combined with regular monitoring is essential for protecting your kidneys and improving your overall health. Follow your healthcare provider's guidance closely to ensure safe and effective treatment. 2. Lifestyle changes for CKD management. Making healthy lifestyle changes is essential for managing chronic kidney disease, CKD, and improving overall well-being. Regular physical activity is highly recommended. Aim for at least 150 minutes of moderate-intensity exercise each week, such as brisk walking or cycling. A healthy diet plays a key role in kidney health. Focus on eating more plant-based foods like fruits, vegetables, whole grains, and legumes while limiting ultra-processed foods. Maintaining a healthy weight through diet and exercise can help reduce the burden on your kidneys and lower the risk of complications. If you smoke, quitting is one of the most impactful changes you can make. Avoiding tobacco products not only benefits your kidneys but also reduces your risk of heart disease, lung disease, and cancer. Our channel offers plenty of helpful tips on lifestyle and dietary changes to manage kidney disease. Check out our videos to learn which foods to avoid. 3. Renal replacement therapy. When chronic kidney disease, CKD, reaches Stage 5, also known as end-stage kidney disease, ESKD, or kidney failure, renal replacement therapy becomes a necessary consideration. This therapy includes dialysis or kidney transplantation. The decision to begin renal replacement therapy is made jointly by you and your doctor based on several factors. While there is no absolute cutoff for starting, KDIGO 2024 guidelines recommend planning for renal replacement therapy when your estimated glomerular filtration rate, eGFR, falls below 1520 mol/min/1. 73 Medi2, signaling a significant decline in kidney function. Dialysis is a life-saving treatment used to filter waste products from the blood when the kidneys are no longer able to do so effectively. There are two main types of dialysis: hemodialysis and peritoneal dialysis. Hemodialysis involves using a machine called a dialyzer to filter the blood. A vascular access point is created and blood circulates through the dialyzer, where it is filtered and returned to the body. Each session typically lasts around 4 hours and is usually performed 3 times a week, though the frequency can vary based on the patient's condition. Peritoneal dialysis uses the natural lining of the abdominal cavity, called the peritoneum, as a filter. A catheter is surgically inserted into the abdomen, and during each dialysis session, a dialysis solution is introduced through the catheter. This solution stays in the abdomen for a period, pulling waste products from the blood through the peritoneum. The solution is then drained from the abdomen and discarded. This form of dialysis can often be done at home, and the frequency of sessions can vary. While dialysis is an effective method for maintaining kidney function, it is not a cure for CKD. Kidney transplantation, when available, may offer a more permanent solution, but comes with its own challenges, including the need for a donor organ and immunosuppressive medications to prevent organ rejection. Financial and physical burden of CKD. The treatment for CKD, particularly in its advanced stages, is costly. According to data from Medicare, the annual spending for people aged 66 years and older with CKD was $75 billion in 2020. Of this, $50. $8 billion was spent on end-stage kidney disease. These costs highlight the substantial financial burden that CKD and its treatments place on both individuals and healthcare systems. Beyond the financial aspect, CKD places a significant physical burden on patients. Dialysis treatments can be exhausting and time-consuming, with patients often experiencing fatigue, discomfort, and limited freedom due to the regularity and duration of treatment sessions. The need for frequent medical visits, lifestyle adjustments, and ongoing management of other health complications, such as heart disease, anemia, and electrolyte imbalances, further impacts the quality of life for CKD patients. Prevention of kidney disease and dialysis. The most effective and safest way to prevent chronic kidney disease, CKD, and the need for dialysis is by adopting a healthy lifestyle. Making positive changes in your daily habits can significantly reduce your risk of kidney disease and improve your overall well-being. Key lifestyle recommendations include healthy diet. Focus on a balanced, nutrient-rich diet with plenty of fruits, vegetables, whole grains, and lean proteins. Reducing sodium intake and avoiding excessive consumption of processed foods and unhealthy fats can help manage blood pressure and prevent kidney damage. 2. Regular physical activity. Engage in at least 150 minutes of moderate-intensity exercise per week. Regular activity helps maintain a healthy weight, improves blood circulation, and reduces the risk of conditions like diabetes and high blood pressure that can lead to CKD. 3. Smoking cessation. Smoking is harmful to your kidneys and cardiovascular system. Quitting smoking reduces the strain on your kidneys and helps maintain overall health. Weight management. Maintaining a healthy weight is crucial for controlling blood pressure, blood sugar, and cholesterol levels. If you're overweight or obese, losing even a small amount of weight can help improve kidney health. Limit alcohol intake. Excessive alcohol consumption can worsen kidney function and contribute to high blood pressure and liver damage. Moderation is key. In addition to these lifestyle changes, it's essential to follow your doctor's recommendations for periodic follow-ups to monitor your kidney function. Regular screenings, especially for people at risk due to hypertension, diabetes, or family history, can help detect CKD early and prevent complications. Conclusion. In summary, chronic kidney disease is diagnosed when there is abnormal kidney function lasting for 3 months or more. Early signs of CKD can include foamy urine, blood in the urine, nocturia, waking up to urinate at night, reduced urine output, and flank pain. CKD is a global health burden, often leading to cardiovascular complications and even death. Unfortunately, many people with CKD are asymptomatic until it's advanced, which increases the risk of disease progression and serious complications. If you have risk factors such as hypertension, diabetes, or a family history of kidney disease, it's essential to stay vigilant for any early signs of CKD and take preventive measures. Being aware of these signs and symptoms can help you take action before the disease progresses. A healthy lifestyle combined with regular screenings is the best strategy to reduce the risk of developing CKD or slowing its progression to kidney failure, which may require dialysis. Taking care of your kidneys through diet, exercise, and regular medical checkups can significantly improve your kidney health and overall quality of life. We want to thank all our subscribers and viewers for their support. Your engagement motivates us to continue sharing valuable content. Don't forget to hit the bell icon to stay updated on our latest videos. If you feel like your kidneys need extra care due to unhealthy habits, check out our video on the top 5 fruits that can help cleanse your kidneys. Stay informed, stay healthy, and take the steps necessary to protect your kidney health today.
Are you worried about your kidney health? You're not alone. Many people suffer from kidney disease, but there's hope. If you have kidney problems, don't be afraid, don't be scared, and don't give up. The National Kidney Foundation says over 37 million Americans have kidney disease, and many are at risk of losing their kidneys. But there's good news. Recent studies show that adopting certain habits can greatly improve kidney health. In this video, we'll look at 7 easy habits that can make a big difference. These habits are simple and backed by science. they can lead to significant improvements in your health. Imagine how comforting it will be to know you're doing everything you can to protect your kidneys. Stay with us until the end of the video to get valuable tips on how to keep your kidneys healthy and boost your overall well-being. Don't miss out. Your kidneys will thank you. Let's start with habit number 7 that helps keep your kidneys healthy. I want to share an inspiring story from someone named Joseph. He managed to control and even reverse his kidney disease through good habits and positive thinking. Here's his story. Joseph was diagnosed with chronic kidney disease, CKD, 4 years ago. His GFR, a measure of kidney function, was around 27, and he didn't know how serious it was. His doctor gave him medication, but his kidney function kept getting worse. He felt exhausted and lost control of his health. This went on for 3 years until he discovered our channel. Joseph learned that changing his diet and lifestyle could help slow down kidney disease. He started walking to work every day, cut out protein, meat, and salt, and used baking soda. Thanks to the advice from our videos, his health improved significantly. After 8 months, his GFR went up to 41, and he felt better than he had in years. His doctor was thrilled with the progress. In today's video, we'll explore the habits that helped Joseph and how you can use them in your own life. Share this message of hope with others who might benefit from these tips. Improving kidney health is possible, and you can make a positive change with the right habits. Let's talk about a powerful eating habit for your kidneys. Eating berries. This is habit number 6, and it's a top way to boost kidney health. If you've been watching my videos, you know I stress the importance of knowing which foods to eat, not just which ones to avoid. Berries are a key part of any healthy kidney-friendly diet I suggest. They're full of antioxidants, which help lower creatinine levels and support overall health. Antioxidants can also lower cholesterol, fight off colds and infections, and improve heart health. Including antioxidants in your diet without too much potassium can be tricky, but berries make it simple. They have a great balance of antioxidants and low potassium, making them ideal for a kidney-friendly diet. Here's why berries are so beneficial. Strawberries can help lower blood pressure and reduce bad cholesterol. Blueberries have the highest antioxidant levels among berries. Raspberries are good for diabetes and heart health. Goji berries support kidney function, and cranberries protect your urinary tract and kidneys from infections. Berries are low in potassium, so you don't need to worry about that. Just a small amount each day can give you all these health benefits. Another great thing about berries is that they're delicious on their own, with no need for added heat, salt, or sugar. So, go ahead and add some berries to your diet. Your kidneys will thank you. Habit number 5, avoiding hidden salt and sugar. Almost every kidney patient is advised to cut down on added salt, and that's absolutely correct. Excessive salt can lead to high blood pressure, heart disease, and even direct kidney damage. Most of you are probably already cautious with your salt shaker, but here's the kicker. 80% of the salt we consume comes from processed foods, not the salt shaker. For example, cured meats and cold cuts can be salt bombs. Some brands of sliced deli turkey have over 1,000 milligrams of sodium in just a 4-ounce serving. Remember, you're only supposed to get 1,500 milligrams of sodium per day. Fast foods, bacon, processed meats, salad dressings, and snacks can have over 1,500 milligrams of sodium per serving. This shows that too much salt often comes from processed foods, not just the salt shaker. But there's something even worse: hidden sugar. Sugar can harm your blood pressure even more than salt and is very addictive. The more you eat, the more you want. Food makers hide sugar in almost everything. For example, fruit juice has more sugar than healthy nutrients. Sports drinks are even worse because they often have both sugar and potassium. Granola, which is often seen as a healthy choice, can be high in calories and sugar, just like many breakfast cereals. Flavored coffees and creamers should also be avoided. Even vitamin water, which seems healthy, has a lot of added sugar. Don't be fooled by advertising. Focus on your health by avoiding hidden salt and sugar to improve your kidney health and overall well-being. Baking soda is a remarkable remedy for those with kidney problems. The healthy habits we've discussed all aim to help the kidneys maintain the body's acid-alkaline balance. When we consume acidic foods, we place extra stress on our kidneys. Baking soda, being highly alkaline, can help reduce this burden. Studies have shown that baking soda can effectively slow the progression of kidney disease Before using baking soda, it's important to get tested for sodium bicarbonate levels and serum potassium to ensure it's appropriate for you and to determine the correct dosage. Some people take 1 gram of baking soda 3 times a day with water, but it's crucial to consult your doctor to find the right dosage for your situation. If you're in stage 4 or 5 of kidney disease and not using baking soda, it's worth discussing with your doctor. It could be essential. Now, let's talk about another natural remedy, astragalus. This adaptogen has shown great promise in slowing down kidney disease. A study found that astragalus extract effectively reduced creatinine levels in patients with advanced kidney disease. Patients took 2.5 grams of astragalus twice daily alongside their usual treatments. Within 3 months, their GFR improved instead of declining, indicating that astragalus could be a valuable addition to your kidney health regimen. Number 2, find out what's causing your kidney issues. I know many of you might already have a good idea of what's behind your kidney problems, but if you have any doubts, or if your doctor hasn't been entirely clear, it's crucial to dig deeper. I understand that spending extra time in hospitals and with doctors can be exhausting and sometimes overwhelming, but trust me, it's absolutely worth it to get to the bottom of things. If you don't have a nephrologist, it's crucial to find one, as they are the experts in managing chronic kidney disease, CKD. Under their care, you'll undergo essential tests to determine the exact cause of your condition. Diabetes and high blood pressure are responsible for over 75% of CKD cases, but other causes include tumors, nephritis, genetic disorders like polycystic kidney disease, and glomerular diseases such as IgA nephropathy. Additional factors like interstitial nephritis, prolonged urinary tract obstructions from an enlarged prostate or kidney stones, recurrent kidney infections, and some cancers can also contribute to kidney damage. In some instances, the cause remains unidentified. The primary goal of treatment is to address the underlying cause. For instance, if diabetes is responsible, controlling blood sugar levels is vital. If CKD stems from another condition, accurate diagnosis and targeted treatment are essential. Misdiagnosis can occur, especially with high blood pressure, which may be mistaken as the cause when it is actually a symptom of kidney disease. Ensuring an accurate diagnosis is critical to effective treatment and management of your kidney health. If you're seeing a nephrologist, they'll likely cover all these bases. But if you're working with a general practitioner or internist, you might need to advocate strongly for comprehensive testing and diagnosis. Keep in mind that medical understanding evolves. For instance, as recently as the 1960s and 70s, high blood pressure was thought to be beneficial for older adults. It wasn't until the late 1970s and early 1980s that research shifted this perspective, and only in the past 2 decades have we fully grasped how even moderately high blood pressure can harm the kidneys. The recommendation to keep the upper number below 120 is a recent development, but is strongly supported by current research. This brings us to our top tip: keep being informed. Just like our friend Joseph discovered, knowledge truly is power. He shared that without diving deep into understanding his condition, he wouldn't have been able to reverse his kidney disease. The world of kidney disease is evolving rapidly. Chronic kidney disease is one of the most overlooked public health issues, but changes are on the horizon. Every day, new breakthroughs and treatments are being researched. We're also seeing significant strides in transplant technology. It's only a matter of years before we might witness the first successful transplant of an artificial kidney. So, stay informed, stay hopeful, and keep exploring the latest advancements. They could make all the difference in your journey. Repair your kidneys in 3 days. This adaptogen tells the kidneys never to give up. Number 7 on our list is an adaptogenic herb that could be a game changer for you, especially if stress is a major part of your life. Chronic illness already adds enough stress, making it feel like a never-ending bad sequel. High cortisol levels, which often accompany stress, can further damage your kidneys, turning what should be a smooth ride into a bumpy road filled with uninvited problems. That's where adaptogens come in, helping to manage stress and protect your kidneys. Let me introduce you to rhodiola, a remarkable adaptogen. Rhodiola not only helps lower cortisol levels, but also reduces stress, improves sleep quality, and supports kidney repair. It's like having a little miracle worker in a bottle. From my experience, rhodiola delivers impressive results, but you don't have to rely on anecdotal evidence alone. Studies show that it can start making a difference in as little as 3 days. That's faster than brewing your morning coffee. Additionally, for those with diabetes, rhodiola might assist in repairing some of the kidney damage caused by the condition. The initial studies supporting rhodiola's benefits were double-blind trials on highly stressed individuals. There's also promising research on diabetic rats with kidney damage, showing positive effects from rhodiola. If those rats could talk, they'd probably call it the best herb ever. Though rhodiola grows in cold, mountainous regions of Europe, you don't need to hike to find it. It's readily available as an extract on Amazon and other supplement stores, typically in doses ranging from 150 to 400 milligrams per day. Many brands offer rhodiola, and countless users swear by its benefits. Number 6 on the list is a supplement that has been scientifically proven to improve kidney function in humans. Yes, I'm talking about measurable improvement, because if it's not measurable, it might as well be science fiction. So, instead of relying on multivitamins, consider taking a multi-antioxidant approach. While there aren't many certainties in managing kidney disease, here's one that's making waves. Antioxidants have been shown to genuinely boost kidney health, even when some doctors may be skeptical. The research, published in the highly respected Cochrane Library, offers some of the most credible findings in health research. Think of it as the Oscars of medical studies. If you're not already using antioxidants for your kidney health, you could be missing out. But it's never too late to start. Some of the most powerful antioxidants for kidney health include vitamin C, sulfur compounds from garlic, catechins from green tea, flavonoids from berries, selenium, coenzyme Q10, and vitamin K2. In my experience, the best strategy is to get as many antioxidants as possible from your diet and complement them with low-dose supplements. The combination of different antioxidants often works better together than any single one alone. Number 5. Finding the right natural treatments for your kidney health. When it comes to taking care of your kidney health, finding the right natural treatments that truly work for you is crucial. Let's go back to the example I mentioned earlier. If we were sitting down for a consultation in my office, my first question would be, do you understand why you have kidney disease? Chronic kidney disease, CKD, is a broad term that covers a wide range of conditions and causes. For some, it may be due to inflammatory issues like nephritis, while for others, genetic factors could be at play. However, the most common causes are diabetes and high blood pressure, or a combination of both. My primary goal would be to identify what's driving your kidney damage and find effective ways to address it. By targeting the root causes, we can make a real difference in managing your condition. In the next steps, we'll explore practical ways to tackle these common causes and improve your kidney health. So, stay tuned for what's coming next. Number 4. A natural approach to managing high blood pressure. Let's discuss a natural approach to managing high blood pressure, especially if you have kidney issues. High blood pressure often accompanies kidney disease, but managing it with multiple medications can sometimes backfire. Many common blood pressure medications can lead to high potassium levels, or, even worse, further kidney damage. But there's good news. I'm here to guide you. As a naturopath, I like to think of myself as a skilled mechanic who fixes issues without creating new ones. When it comes to managing blood pressure, there's one vitamin that might help you reduce your reliance on medications: vitamin D. Recent research has shown that vitamin D plays a crucial role in lowering blood pressure by modulating the renin-angiotensin-aldosterone system, RAS, which regulates blood pressure and fluid balance in the body. It's like discovering that a vitamin I already recommend for bone health also helps with blood pressure. It's a bit like finding out my cat could do my taxes. If you're deficient in vitamin D, a condition affecting nearly 90% of kidney patients, your blood pressure medications might not work as effectively. So, supplementing with vitamin D could be a game changer for your blood pressure management. But there's more. Another powerful tool for managing blood pressure is coenzyme Q10, CoQ10. Like vitamin D, CoQ10 is an antioxidant that helps restore levels in the body. Low CoQ10 levels, common in people over 50 or those taking certain medications, can contribute to kidney damage. CoQ10 isn't just a potent antioxidant. It's also one of the most effective natural remedies for lowering blood pressure. Studies have shown that it can reduce blood pressure by up to 17/10 mmHg, which is impressive. Combining CoQ10 with vitamin D, and possibly magnesium, could help you lower or even eliminate some of your blood pressure medications. Remember, fewer medications mean a better chance of improving your overall health. Stay tuned for tip number 3, where we'll explore more ways to support your kidney health. Number 3, managing diabetes. Let's dive into an essential topic: managing diabetes, the leading cause of kidney disease. To truly impact your kidney health, a holistic approach to diabetes management is crucial. Instead of relying solely on medications, which can sometimes feel overwhelming, it's important to make lifestyle changes. The first step in managing type 2 diabetes is to focus on diet and exercise, as these are key in reducing visceral fat, the harmful fat around your organs that contributes to the condition. A healthy diet and regular exercise can often be more effective than insulin injections. In addition to these lifestyle changes, certain supplements can provide valuable support. One of my top recommendations is a combination of berberine and banaba extract. Berberine is particularly noteworthy as it's as effective as metformin for lowering blood sugar, but with fewer side effects. It also aids in weight loss. I usually recommend taking 500 milligrams of berberine 3 times a day, about 30 minutes before meals. Berberine not only reduces glucose production, but also helps control appetite, giving your metabolism a boost. Another beneficial supplement is chromium, an essential trace element that helps stabilize and lower blood sugar levels by enhancing insulin sensitivity. Even if you're already on medications like metformin, chromium can complement your treatment, further managing blood sugar and potentially reducing your medication needs. Stay tuned for my next tip, where we'll explore more strategies to support your health. Number 2, find what works for you. The tip number 2 is all about finding what works best for you. You don't need to turn your kitchen into a supplement store or go on a scavenger hunt for every pill and powder out there. Instead, focus on a few key supplements that can truly make a difference. Think of it as creating a greatest hits album for your kidney health. The supplements we've discussed today are backed by medical research for effectively addressing common causes of CKD, helping reduce the need for medication and minimizing side effects and toxicity to your kidneys. If you've been following along, you've likely seen other recommendations tailored to your specific needs. But here's the key: never start multiple supplements at once. Treat it like dating. Focus on one supplement at a time. When you introduce a new supplement, monitor your levels and check how your GFR, glomerular filtration rate, is doing at your next appointment. If you see improvement, you'll not only boost your kidney function, but also know exactly which supplement is working for you. Plus, you might even earn a virtual high five from me. Now, there's one final step to ensure you're on the right path to better kidney health. Stay tuned for more. Here's where a personal health journal comes into play. I swear by this simple spreadsheet I use to track my diet, lab results, and workouts. It's not just a tool, it's a powerful habit that can make a real difference. By diligently noting down everything, you'll be able to monitor how natural remedies and lifestyle changes are affecting your blood pressure, cholesterol, and blood sugar levels. This kind of tracking helps you identify which medications you might no longer need, ultimately improving your kidney function. And let's be honest, many people with kidney disease are still prescribed medications that can do more harm than good. So, start using a health journal today. It's a simple yet incredibly effective way to take charge of your health and make informed decisions about your treatment. Thank you for watching. We hope you found these tips helpful in giving your kidneys the support they need. Remember, adapting to new routines can take time, but every small step counts. We'd love to hear from you. Have you tried any adaptogens or kidney-friendly practices? Share your experiences in the comments below and connect with others who are on the same journey. Together, we can support each other in maintaining healthy kidneys. Before we wrap up, it's essential to remember that everyone's journey to better kidney health is unique. What works wonders for one person might not have the same effect for another. That's why it's so important to stay informed. Listen to your body and work closely with your healthcare provider to find the best approach for you. Whether it's adopting new dietary habits, incorporating natural remedies, or making lifestyle changes, the key is consistency and patience. Healing and maintaining your kidney health is a marathon, not a sprint. As you embark on this journey, don't hesitate to reach out for support. Whether it's from a medical professional, a support group, or even our community here, connecting with others can provide the encouragement you need to keep going. Together, we can navigate the challenges and celebrate the victories, no matter how small they may seem. Thank you for being part of our community. By staying engaged, asking questions, and sharing your experiences, you're contributing to a positive movement that empowers others to take control of their kidney health. Until next time, take care of yourself and stay committed to your health journey. Don't forget to like, subscribe, and hit the notification bell for more helpful content.